so simple.
Okay. Yes. Hello, sir. Good afternoon. Sir, you can start your session, sir.
Okay. So, good afternoon, everyone. My name is PDSS Prakash, Associate Professor in the Department of Pharmacy Practice and Malla Reddy College of Pharmacy. లేదు సార్ నాది మ్యూట్ లేదు. Okay. So today we are going to delve into healthcare system structures in India. As being a citizens of this country, we would have already been known about the public sector kind and as well as the private sector kind. In case of looking into the infrastructure details, we would know that plethora of the population would be using primary health centers and as well as community health centers that are going to cater the needs of immunization, maternal and child health, and most of all, outpatient services. If we look into the policies, the most probably being funded by the state governments and as well as a central policy is called as a national health mission. So this is a one which would have been very much into the role of the healthcare sector. As you can see, the very common challenges we are going to observe are overcrowding and inadequate infrastructure, and we have a lackage of medical personnel. So that's going to have a most significant impact. In private sector, you're going to see that 70% of outpatient services are being contributed and 60% of inpatient care. So here we have to understand the majority of the population, if they are being looked into a healthcare, so what they're going to actually prefer. And most probably here we are going to see it is going to range from an individual practitioners to a very large chain of hospitals. And the most significant concern which we have seen that is most being present after the COVID pandemic is out of pocket expenses. The healthcare costs have increased and that would have rushed majority of the students into patients into a poverty, so that has exacerbated financial inequity. So here we are going to see there are a few instrumental things like medical tourisms and telemedicine services have become improved. So which is going to make India a global hub for affordable treatment. So when we are talking about the term affordable, so that is more in case of foreigners, because you see, in case of foreign, there would be a higher expenditure compared to India. So that would have given a very good opportunity for them to migrate to this country to have the health benefits at a very lower cost. That's what we are going to observe in private health sectors, and most probably the medical tourism that is being promoted. So, since we have already said the topic of concern is health policy, so we are going to see how much the health equity is being presented and what kind of economical factors that are going to be playing a key role in improving the healthcare. So, first, delve into the key concepts, here we are going to see about equity in healthcare. So when we are talking about equity, so we would usually resemble with the word equality. So that means we see the most significant spending in our country goes for education and after that healthcare. So in these cases, you are going to observe in health equity, one would want to have a great expansion, or they are having a very probabilistic ideas to make the population have a fair access to health services. So here there are socioeconomic factors, geographical factors, and sometimes even the demographics. And basically, we would understand urban population have a better access to sophisticated healthcare than what we compare with the rural population. In current scenario, here you can see as we grew to the population of 1.4 billion people, so we see 70% will be more residing in the rural areas, but you are going to see 80% improvement had happened in urban centers. That means despite a low population, we would see the infrastructure being developed more in urban settings. As you can see, the rural people cannot have a greater access, or we can say a required access. And the next most concern here you are going to observe is out of pocket expenditure. We would come across a things called as a health insurance, but we would not know like how many people are actually being using this health insurance. In this case, here you are going to see the high proportion of out of pocket expenditure. So that is, you can see the values which is close to 63%, as that is being borne by the households. So when you are comparing it with the whole world, so you can see of average 18.2%, but we have a very greater expenditures. So that would have led to the poverty. And I would particularly quote a word called as a catastrophic healthcare expenditures. That is nothing but it would drive a family into a very severe economical status just because one person of that household got hospitalized, and the expenditure was quite tremendous than what they can bear. So here you can see that catastrophic changes might also happen. And other things we are going to see economic resilience, that is nothing but how the healthcare system could be able to respond to a crisis situation. The most common crisis situation we have seen is COVID-19. So we would have seen how the healthcare system has become more vulnerable. It could not be able to meet the demands. So those kind of changes have been observed, which has been a greater economical strain both to the government and to the population. So you see a lot of things have happened. The oxygen availability has become shortened, and you could not able to find enough beds in intensive care units, and the hospitals could not even provide an infrastructure to support the lives of people. All these would have had a greater impact. And next thing here we can see innovation. So this, as we can mention, as a post-COVID era, even the healthcare systems were finding to develop a new tools and technologies to enhance the healthcare delivery so that majority of the population can access. The main key innovations you can see is telemedicine, just like an e-sanjeevani. We are going to learn that in a coming section. And also digital health ecosystems. Specifically, I can give an example of National Digital Health Mission. Not only these, but here we are going to see further about Ayushman Bharat, all of those which have provided a greater accessibility towards healthcare. So before we are going to enter into the topic, I just want to give a brief info about historical context, how the Indian healthcare system has brought its shape than what it happened to be before. In the very first thing, you can see pre-independence era. So that means we usually be looking into the British rule, so where we have seen only an elite section of the people in that country, especially colonial officials, had the access to that healthcare, and it was underdeveloped, and it had a very indigenous practices, so not a sophisticated ones, but those which we have believed to actually work, just like an Ayurveda, Unani, and Siddha. So that means at that point, the rural people and as well as the urban people were more entrenched with the disparities because only a minor population had an accessibility. The only thing the changes had occurred is after the independence. So that too, we are going to see a timeline in a chronological order. So the first thing you're going to look is a Bohr committee report. So this has happened in 1946, and this would have helped in assessing the healthcare policy in India during the independence era. So here it had advocated a comprehensive, and it had also suggested for a state funding towards the healthcare system. So especially more focused across the rural India. And the next thing you're going to see about something which had a concern about communicable diseases. As we know, in the older days, a lot of mortality rates had observed with the communicable diseases, so especially tuberculosis. So for that reason, they have mentioned about a early 5-year plans. So you need to have an anticipation towards the healthcare and what you can give inputs into that. And after that, you can see liberalization term, and also certain healthcare reforms have happened. So in the early 1990s, you can see the changes have occurred. The people have opened the doors for private sector participation. And because of that, the quality of care has increased for urban populations. But still, it was not affordable for many people. And following, you can see National Rural Health Mission, as we have specified previously, it was more focused on maternal and child health. So this would have been more towards the women welfare. And Ayushman Bharat, so this was a prestigious product. So in order to provide a all over coverage of healthcare qualities. So this was said to be the world's largest government funded healthcare scheme. So, in key policy innovations, we are going to see a lot of things which were brought by the Indian government one by one. So, first thing you see about Ayushman Bharat, and it could be called like Pradhan Mantri Jan Arogya Yojana. So, it was launched in 2018. As one would see, it has aimed to cover up to 5 lakh rupees per family in case if the person would want to access the care in secondary and tertiary care hospitalization. So this was applicable to over 100 millions of families. And the main target line was towards 40% of people. And in case you are going to see these achievements by 2023, as per the report, 23 million hospital admissions were facilitated. So that means it had covered a very greater extent of the population. And financial impact, so it saved actually 30,000 crores in medical cost. So the patients would not have been burdened from their own pocket expenses. And you can see that healthcare access expansion, 55% of the hospitals who have participated under this Pradhan Mantri Yojana. So like here we can see that highest quality tertiary care was promised. And we can see the rural populations over 60% have been benefited. So that indicates there is a correct addressing to ensure the gap is going to be reduced in the rural healthcare infrastructure. And we see, even though there is a wide accomplishments, there could be some obstacles or challenges. In state level disparity, you can see Orissa and Telangana had opted out from this Pradhan Mantri Yojana. So, whereas they have implemented their own state level health insurance programs. I would say for Telangana and particularly of Andhra Pradesh, Arogya Sri Yojana. And also you can see of infrastructure gaps. Even though rural hospitalized are acclimatized to this healthcare, yet they are failing to provide enough quality care. For that reason, people have been observing delayed treatments that would have resulted in deterioration of health. And moreover, they were referred to private hospitals, which had forced them to take more out of pocket expenditures. And you can see what could be the future directions. We would expect an integration with digital health ecosystems. On that aspect, there was this Ayushman Bharat digital mission. So, in that particular aspect, the government aims to integrate patient data with National Digital Health Mission so that it could ensure there is a smooth operation between the healthcare providers and streamlining patient care. We have to understand in Indian healthcare system, if one would want to cover the health insurance aspects of a patient, they would need an approval. So that approval could be streamlined if possibly brought under this digital health ecosystems. And also we can see National Health Mission. This is going to be the most significant one, which was launched in the year 2009. The main aim was to make it more accessible, affordable, and to give more quality, that to both rural and urban populations. As we know from the words, National Rural Health Mission, so that had targeted the rural health, and Urban Health Mission. It was launched thereafter in 2013. So more focused on urban people, but those who are unaffordable, and they would be coming under below poverty line. So that is poor and slum population. And in case if we talk about the achievements, here we can see reduction in maternal mortality rate. So that means if you are expecting a live births, you can see the range how it had reduced. If there were a live births of 1 lakh, that in 1990 you can expect the mortality happened at the rate of 556, but it was brought down to 103. We can say that to be a very great contribution. And in case of infant mortality rate, it has dropped from 80 to 28 in case of 1,000 live births. And this is also one of the greater appreciable thing. And in case if we talk about this accredited social health activists, this program has trained over 9 lakh personals. So these people are very much involved as a health intermediaries so that they would address the health challenges in the rural population, and they can transform these difficulties, and they can address these challenges, and they can bring to the attention to the healthcare system. And without these people, it would have been a very difficult for the rural population to access the healthcare. And next thing we can see, even though it might be a very successful mission, but in few cases we can see about underfunded facilities. So here we can say understaffed would also be there. That means in 2009 report, you can see 18% of primary healthcare centers do not meet infrastructure standards. That means the population who have been residing over there would definitely be affected. So here we can see that a shortage of skilled healthcare workers is going to be a very important requirement. So where the doctor to patient ratio stands for 1 is to 1,511. So that means here you can see when compared to WHO, here the doctors would be having a more demand. So as part of a future direction, you would expect a furthermore investment in rural healthcare infrastructures. When coming to this National Digital Health Mission, you can see this was launched in 2020. So here there was a very innovative way of using this digital platform. That is, it was willing to give a unique digital health ID so that it would be registered under National Health Registry, so that more data could be incorporated and it can integrate, analyzed, and it could be brought to decision analytics where it can address key features. So here the key features would be the first thing and obvious thing is health ID, and also improvement of digital health ecosystems and telemedicine integration services. The most common one we are being called as e-Sanjeevani. So achievements here we can see more than 300 million health IDs have been created, and also it had saved nearly 500 billion rupees, that equals to 6.7 billion dollars of spendings. And challenges you can see digital literacy barriers. You would not expect a rural area people and elderly population to use digital platforms effectively. So that would have brought a very big obstacle. And also, the population would even express data privacy concerns because we would know medical data is being more sensitive. We would expect a very stringent data security. And here we have been seeing the future direction would be nothing but a wider adaptation of telemedicine. Because for small and we can say not so serious concerns, telemedicine would be having a very greater advantage and even to certain follow ups also. That would be reducing the waiting time towards accessing the healthcare. So coming to this eSanjeevani, as we spoke, it is a national telemedicine service. It was launched in 2019. So it was improving more with teleconsultations, especially from the rural population. So till date of 2023, over 50 million teleconsultations have happened. So the contribution was very quite large, and it has saved a government for around 500 crore rupees, and also it had covered around 500 districts. So as you can see, the challenges is technology accessibility, mainly of internet access. So that could be providing a hindrance to those who want to use this kind of feature. And also even healthcare providers would definitely require a training to access these kind of telemedicine platforms. So you can see what could be the challenges. The biggest challenge is rural versus urban division. So how much India needs is nothing but an additional 2 million hospital beds. And also it needs to upgrade its primary healthcare centers. But here we are going to see, apart from the infrastructure, we can see a shortage of skilled workers. So shortage of 2 million nurses and 600,000 doctors. And when we are taking this economical consideration, we can see this healthcare financing and low public spending. So if we are taking the whole budget into the display, the government, how much it could be able to spend towards the healthcare is being presented. So as you can see in this case, India's public healthcare expenditure is only going to be 1.28% of GDP in 2022. So as we are bringing all the stats related to 2022, we can see that would be only compared to be of global average 6.3%. We are only spending 1.28%. So this could be called as an underinvestment. So lack of infrastructure, workforce, and any disparities in the research are going to leave many hospitals and clinics underfunded and ill-equipped. And also we have seen healthcare costs have increased. Out of pocket expenditures could have been increased. All this could be leading to more financial distress and also impoverishment. So we are going to look ahead for most of the things. So what you are going to look for, you expect an increase in the public healthcare spending at least of 3% of GDP. And also we need to focus more on preventive healthcare so that you would reduce the burden of chronic diseases and increase the financial stability. When we are talking about economical impact, so we can see high out of pocket expenses are going to be the most important concern, where 55 million Indians have brought to poverty. And medications, diagnostics, all these have been contributed more to the expenses, and that is what the term mentions, catastrophic health expenditures. For that reason, here we are going to see certain government programs like Jan Aushadhi Yojana and free drug distribution schemes and universal immunization programs. All these are aiming to reduce the financial burden. But if we retrospect ourselves and if we look into more details, we have a very long way to reach financial development goals. So, particularly, which is going to attribute towards universal health coverage. So our other agendas will be strengthening the digital health and also ensure the privacy, digital literacy and affordability and health preparedness. The COVID-19 has taught a very important lesson. So here we have to understand not only about the prevention and treatment, but we need to have a very good disease surveillance and also a strengthened emergency response services should be there in order to handle a future pandemics and also health crisis. And the very detailed aspects could be looked into this public private partnerships in the healthcare. So those would certainly give benefit, But here we can see why people would be opting more for private rather than public is because of main infrastructure shortage. So here you can see certain kind of programs like national dialysis program. So a lot of people have been having this kidney diseases. So under this Pradhan Mantri National Dialysis Program, so which is going to operate on public-private partnerships, it's going to provide free dialysis services in government hospitals through participation along with private players. When we talk about the telemedicine, we have a best example from Karnataka. So that would have allowed patients even in the remote areas to consult the specialists in the urban centers, and it would have reduced them any transportation burden and also a timely access to the healthcare. So with this, I would like to conclude regarding the health policy aspects. The main agenda will be always focused on promoting the health equity. That is nothing but accessibility should be equal to each and every citizen in this country. And moreover, economical viability, as we would see, that should not create a burden in terms of expenses to the family. So let us expect a good health for a very good citizens of our country. Thank you very much and have a great day.